Does the Secretary of State not agree that the system should have been in place before lockdown was eased? Without it, how can he know that the crowded public transport systems we saw last week aren't already leading to a rise in infections? The Secretary of State prides himself on having ramped up testing, but we know that many of thousands of those are just in the post. So can he clarify if these tests are counted again when they're actually carried out? The Royal College of GPs has highlighted the difficulty in getting test results back from the Deloitte regional test centres, as it's actually contact tracing and isolation that stops the spread of the virus. How will he speed up results and ensure that they're fed back to GPs and public health teams who are critical to detecting and controlling local outbreaks? The UK still has over 6 times the number of new cases per day than when the lockdown was brought in. Does he not think that's still too high to be sending people back to work and school?
And I'm very glad to see in Scotland testing capacity is now starting to rise to the latest figures of around 5,000. I work very closely with my SNP opposite number on making sure that everybody has the very best capacity. Now, of course, the contact tracing system was also stopped in Scotland. The reason for that is because the number of cases right across the UK became very high. We needed social distancing to bring that number down. Now that number is coming down right across the UK. It means that contact tracing is once again effective. That's the reason that we're bringing it in now, and I'm really pleased that we've hired in England 21,000 contact tracers to make sure that we can get this going.